Parkinsonism is a symptom complex composed of 4 different cardinal sets of signs and symptoms. The first of these is tremor. Tremor is an abnormal involuntary movement which consists of alternating rhythmic involvement of the agonist and antagonist at any one joint. This gentleman demonstrates tremor of both upper extremities, both lower extremities, and his jaw. The tremor of Parkinsonism is characteristically present at rest and ameliorated, at least in part, by the initiation of purposeful movement. Although tremor is perhaps the best known of the signs and symptoms of Parkinsonism, it is not invariably present. The presence, however, of a rest tremor like this is pathognomonic of Parkinsonism. Here we see the tremor of both hands ameliorated by the initiation of purposeful movement, and the recurrence of the tremor after the hands rest on the knees. This is the classic rest tremor of Parkinsonism. Throughout these hand motions, the tremor of the jaw persists. Again, we see purposeful movement ameliorating the tremor in the hands, while the jaw tremor persists and the hand tremor returns following the purposeful movement. Second of the cardinal signs and symptoms of Parkinsonism, akinesia refers to difficulty in initiating and carrying out purposeful movements. The term bradykinesia or hyperkinesia are also used, but are really synonymous with akinesia. Here we have the same gentleman having difficulty initiating standing from a seating position. Now the gentleman is seated in a chair that is higher, that is easier for a Parkinson patient to get out of. The same patient with his rest tremor initiating gait. Steps are small, shuffling. Turning is accomplished with many small steps. Again, initiates movements with slow, small steps. There's also a lack of swinging of the arms, what is known as decreased associated movements during walking. Again, the small shuffling steps of a Parkinson patient. When Parkinson patients are asked to step over lines, however, they can walk with a fairly normal gait. And again, we see the normal gait there and the small shuffling steps when he walks without the guidance of lines. And turning with many small steps and a lack of another manifestation of the akinesia of Parkinsonism is the mask and none of the normal play of expression that we see on a normal face. He also tends to stare without blinking, a phenomenon known as a reptilian stare.